Thank you, everybody, for joining us today. My name is Priscilla, and my pronouns are she, her. Thank you for joining us for our COVID-19 community conversations hosted by UW Medicine and the Office of Healthcare Equity. We have a really exciting topic today. We're talking about long COVID. With that, I will turn this over to Dr. Chopra. In addition, I will be putting some links in the chat where you can find the recordings for these sessions and past sessions, as well as the information for our post-COVID-19 clinic for you all to check out. Thank you.
Thank you, Priscilla. Hello, everyone, and welcome to this really important discussion today through community conversations. UW Medicine is committed to bring you the latest in our community health efforts, but also to provide education and raise awareness in the community. COVID has many unknowns and has thrown us great curveballs over the last 2 years, but one of the biggest ones is long COVID. I would like to, focus our discussion today on long COVID. I'm honored to have Dr. Jana Friedli. Dr. Friedli is Editor-in-Chief, Physical Medicine and Rehab. She's Vice Chair for Clinical Affairs, Department of Rehabilitation Medicine, University of Washington. Thank you so very much for joining us, Dr. Friedli. I'm also joined by Priscilla Estrada, who is the Communications and Workforce Engagement Specialist, Office of Healthcare Equity at UW Medicine. And I am Anita Chopra. I am an internal medicine physician at UW Medicine Shoreline. Dr. Friedli, let's start today with the real basics of long COVID. How do we define it and how do we diagnose it? How do we label somebody with long COVID?
Great. Well, thank you so much for having me here today. And just before I launch into that, I just want to give a little bit of background about my experience with long COVID. So I direct the UW Medicine's post-COVID rehab and recovery clinic, and we have been seeing patients in this clinic since May of 2020. So we have about a year and a half or more of experience seeing these patients. And so a lot of what I'll talk about today and is really related to my clinical experience with these patients. So, in terms of what is it and how do you define it and diagnose it? It's as you just said, there's a lot of unknowns, and this is one of the things that is still evolving, and so it can be confusing to people to understand what long COVID is. But essentially, long COVID is a variety of symptoms that people experience, typically considered to be a month after or longer after they were initially infected with COVID. So there's been different definitions that have been developed by the World Health Organization and the CDC and NICE, and there are some different slight versions of the definition, but in general, I think people tend to use 1 month after initial infection if you're still having a variety of symptoms that you didn't have prior to your infection with COVID, that defines long COVID. So I think one of the challenges and one of the frustrations for patients and for clinicians is that there isn't a specific lab test. There isn't a specific diagnostic test for long COVID. So it really requires the history of having COVID and having these new symptoms. And the symptoms can be a huge range of different symptoms. There are more than 200 reported symptoms associated with long COVID. And so you can have any combination of symptoms that you didn't have before. Most of the time, people, so the most prevalent symptoms that people are experiencing are fatigue. So the vast majority of people are experiencing fatigue, post-exertional malaise or inability to exercise, and cognitive symptoms. So what people describe as brain fog, cognitive symptoms. But there's a whole host of other symptoms that are really common: headaches, sleep disturbance, a variety of neurologic symptoms, pain, a number of different, in addition to headaches, other painful conditions as well.
Thank you so much, Dr. Friedli. Are there any diagnostic tests that you are using to diagnose people with long COVID?
There aren't currently any diagnostic tests, and I think what's important to note with for example, the CDC definition of long COVID is that they specifically recognize that there aren't any specific tests for it, and that you can have that the absence of any abnormalities on lab tests or imaging findings doesn't preclude you from having long COVID, and doesn't mean that you're not experiencing severe long COVID, or that it doesn't correlate with the severity and the importance of the symptoms that people are experiencing. A lot of the patients in our clinic as well were developed their COVID very early in the pandemic, when they either couldn't get access to testing or potentially had false negative tests or didn't get tested at quite the right time. And so they don't even have necessarily a documented positive COVID test, which makes it also really confusing for patients and clinicians. And I think especially early on in the pandemic, before we even recognized what long COVID was, there were a lot of people that had COVID or symptoms of COVID, and then developed these ongoing persistent symptoms that they couldn't explain. And that really created a lot of stress and anxiety, and also I think led to some really poor experiences for some of the patients, because they felt that they were being discounted or not heard and not understood. But now, as we look back and we've done studies, where it's very clear that there's a group of people, especially early in the pandemic, that just were not tested for COVID or didn't even have a documented COVID test. So currently there's no specific diagnostic test for COVID. There are some clinics around the country that have developed sort of lab panels that are looking at inflammatory markers and autoantibodies and other things like that, to develop some kind of diagnostic criteria, but there's nothing that's been validated yet, and nothing that is commercially available that can consistently diagnose long COVID.
So just to capitulate what you said, people may have had a negative COVID test, or they may not have been tested for COVID, yet they could have long COVID. They could display symptoms of long COVID. Is that right?
Yeah, absolutely. We've seen quite a bit of that. And I think it's also important to recognize that a lot of the symptoms of long COVID overlap with other conditions, which also adds to the confusion for people. Long COVID symptoms overlap quite a bit with chronic fatigue syndrome and POTS, or postural orthostatic tachycardia syndrome, and concussion symptoms. And so there's a lot of overlap between the symptoms of long COVID and other conditions. So sometimes it can be confusing, because people may have one of these other conditions that mimic long COVID as well. And so that adds to the challenge.
And Dr. Friedli, would you talk a little bit about your clinic, the long COVID clinic at UW? How did it come about, and how are patients referred to you? How do they get to know about the clinic?
So we started, as I said, the clinic back in May of 2020. And when we started this clinic, it was just a few of us in rehab medicine, so a few physiatrists. And we, at that time, recognized that people who were hospitalized with severe COVID had prolonged hospital stays. They were in the ICU oftentimes for long periods of time and were needing rehabilitation services after, while they were recovering. So we started this clinic really thinking that we were going to see primarily people who were hospitalized that had ICU acquired weakness and deconditioning and other neurologic sequelae from being in the hospital. And then very quickly after we started the clinic, we recognized that there was this whole population of patients that were not coming to the hospital with COVID. So they were having more mild to moderate COVID infections initially, but had developed these longer term sequelae and symptoms. And so we opened up the clinic very quickly to anyone who had COVID. Really over the last year and a half, we've just seen this consistent increase in the number of patients being referred to our clinic. So, we now have about 13 physicians who are in our clinic. We initially started with a few rehab physicians, and now it's a multidisciplinary clinic in partnership with general internal medicine and family medicine. And we work very closely with a wide variety of specialists that are critical to making sure that we're providing comprehensive care for people. So our clinic is a combination of telemedicine and in-person visits. We're based out of Harborview Medical Center, but we have physicians in multiple locations across UW-Medicine. And a network of people who are really starting to specialize in long COVID. So patients can be self-referred, and we get lots of self-referrals. We have a website, I think they're putting it up in the chat, that people can find the contact information for. And then we get referrals from really all over the state. While the public health emergency allowed us to do telemedicine with patients who were in Alaska and Montana and Idaho. We were seeing patients from really the 5-state area, but now we're primarily limited to Washington State. We do see patients from Montana as well, as I have a license in Montana now to be able to do that. And we're working on being able to see people from Alaska because the access there is pretty limited.
Thank you so much. Dr. Friedli, could you talk a little bit about what percentage of asymptomatic people who were initially asymptomatic that you see now with long COVID?
Yeah, so it's a little bit hard to answer that question because we certainly in our clinic are seeing just a subset of the patients with long COVID. So if you think about worldwide, how many millions of people have been infected with COVID? It's now what I think over 250 million people have been infected with COVID, and the reported prevalence of long COVID symptoms has reigned. When you look at the systematic reviews of all the different studies, there was a really nice systematic review recently, a review of all the different studies around the world, that they reported a prevalence of between 30% and 70 or more % of patients who were initially infected with COVID developing long COVID symptoms. So you can see there's a huge range in the prevalence. So any of the answers to my questions based on the very small subset of patients that I'm seeing in the clinic is probably not representative of the entire population. So it's a little bit hard for me to answer that question. I think what we can say is that there are certainly cases of people who have very mild symptoms initially who are developing long COVID symptoms. But in terms of percentages of patients with asymptomatic infections who are getting long COVID, I think it's pretty small. And certainly it's much more common to have more severe, longer term symptoms, the more severe the initial infection was. But that's not a direct correlation.
Thank you for that. Dr. Friedli, another question that people have is, have you seen any correlation with being vaccinated and getting long COVID? Are you seeing people who were vaccinated and who still have developed long COVID?
Yeah, so I'd say, as you can imagine, our experience evolves over time in the clinic. So probably for the first year or more, everyone in our clinic was unvaccinated at the time that they were infected, just because the vaccines weren't available, and so we were really seeing people who were infected very early on. Now, as people are starting to become vaccinated, we are seeing patients in the clinic that were vaccinated at the time of infection. But I think more of the patients that we're seeing were unvaccinated at the time that they were infected. So it's certainly possible to get longer term symptoms of COVID after, if you get infected after you're vaccinated. But I think, from our experience and from the data that I'm seeing, it seems to be certainly much less.
I think that really goes on to underline and emphasize the importance of vaccines to get not only the 2 shots, but also your boosters, because that definitely protects not only against the acute COVID, severe COVID symptoms, but also the long COVID symptoms as well.
Yeah.
Dr. Friedli, the next question I have is, are people who have had Omicron, are they developing long COVID symptoms as well?
I think it's a little too early to really say. So when you think about the definition of long COVID as having symptoms for more than a month, we're still in the midst of seeing the effects of Omicron. So I think over the next few months, we'll probably have a better handle on that and a better ability to determine. I certainly have seen some patients in my clinic that were infected, likely with Omicron in the last couple of months. But we don't have enough experience to know how long their symptoms will last and how that's different. I would say another common question that people ask me is whether having a booster or getting a vaccine after you have an infection with COVID and you have long COVID symptoms, if that affects your long COVID symptoms. And there's certainly been anecdotal reports and some studies that suggest that there's a subset of patients that do report improvement of their long COVID symptoms after getting vaccinated. And we've certainly seen that in our clinic as well. The largest study that I've seen really suggests that the vast majority of people who get the vaccine after they have long COVID symptoms don't really have a change in their symptoms. So it's not getting worse. It's most likely not going to affect the symptoms, but in a subset, maybe 20-30% of patients, they are reporting benefit. So again, that also sort of speaks to the importance of getting vaccinated, even though you've had COVID and have long COVID symptoms.
That's really really important information, and it really does underline the fact that even if you've had COVID or long COVID, it's not too late to get your boosters. We do want people to get their vaccination, as it does help. Dr. Friedli, I would like to shift slightly to some of the most commonly described symptoms of long COVID, and one of them is chronic fatigue. And I've seen patients in clinic, they are unable to exercise, go back to their pre-COVID normal lives, and it impacts, the fatigue is so immense that it impacts all of their activities of daily life. Can you speak about that a little bit and how that is managed?
Yeah, so absolutely. Fatigue is the number one concern that people have when they come to see us. And probably a close second is sort of post-exertional malaise or post-exertional fatigue and muscle pain. So those are two of the most common things that we see. And I think we draw a lot from our experience in working with people with chronic fatigue syndrome, even prior to COVID, and what's worked in those patients. And so a lot of our strategies overlap with what we have done for many years with people with chronic fatigue. Our general approach is, first really to understand the fatigue and how it affects people's lives, and what people's goals are, what's really important to them to get back to doing, and how the fatigue is impacting their lives. And then we do a comprehensive evaluation to make sure that there aren't secondary causes of fatigue, things that are contributing to the fatigue that need to be managed, things like thyroid issues or electrolyte abnormalities, other nutritional deficiencies and things like that. So we evaluate for all the things that can potentially contribute to fatigue. And importantly, some of the coexisting symptoms that are impacting your fatigue, things like not being able to sleep. And if you're not getting good sleep, you're going to be fatigued no matter what, right? So, addressing your mood and how that impacts fatigue, and pain as well, because that can impact fatigue. So we look at fatigue sort of in the big picture of things, and really try to address all of the different things that can impact fatigue. We've had a lot of success with some behavioral strategies. So we talk about the 4 Ps of chronic fatigue management. So really, planning and prioritizing, positioning and pacing. And so we spend a lot of time helping people to identify what goals they have and what they really want to be able to do, and figure out how to use those strategies to accomplish the goals that they want to accomplish given the fatigue that they have. And then developing a very sort of specific, very gradual exercise program to help with fatigue, in addition to all of the other things. So that's my sort of general approach to fatigue management. And I think, this, we may talk about this a little bit more, but there's a lot of research going on and emerging evidence about the mechanisms of, why people are developing fatigue and why people are developing all of these other symptoms related to long COVID. But at least we know that it, to some extent, it involves your immune system response to COVID, and a prolonged immune system response, and with that sort of prolonged inflammation. So we do a lot of strategies to try to reduce inflammation, and that does seem to be really helping with some of the symptoms of fatigue in particular.
That's really helpful, and it sounds like it's a multidisciplinary approach that you use towards managing fatigue.
Yeah, and I was going to say, I think along that lines, I think the important message to everyone is that there is not one specific treatment for fatigue or for any of the symptoms with COVID. I think everybody's looking for that one treatment that's going to treat all of their symptoms and be effective for all patients, and that's just not the case. It really has to be tailored. And oftentimes it takes 6 or 7 different strategies, sort of all in one package, to be able to really help people recover and have their symptoms improve.
And it's also really heartening to know that, patients who are dealing with these symptoms, at least they know that there is someone out there who is able to help them. I think that is really, really important. The next question, Dr. Friedli, that I have is about the heart and lung issues. Either people who had existing cardiovascular problems, or people who had no problems at all, and now they are developing shortness of breath, or they are developing, again, with the fatigue or limitations to their exercise, limitations to how much they can walk. What are you seeing with regards to heart and lung issues, and how are you managing those?
Yeah, so I think let's say a few different things. It's a pretty big question to tackle, but Certainly COVID can have direct effects on your lungs and your heart. We certainly see that and people who are hospitalized, oftentimes there are direct effects on the lungs and the heart. So, we have to comprehensively evaluate that and make sure that we have we really understand how the heart and lungs are functioning and rule out some of the structural issues that are happening in the heart and lungs. That's certainly important. But the vast majority of the patients who had mild to moderate initial COVID infections, their symptoms of breathlessness or feeling short of breath or their heart racing or tachycardia, the vast majority of the time those aren't really representative of a heart problem or a lung problem per se. It's more of a systemic issue. It goes back to the immune system response and inflammation and dysregulation of your autonomic nervous system sometimes. And oftentimes it's got multiple different causes. So it's not one specific cause. So I caution people in thinking about, is this a heart problem or a lung problem? Most of the time it's more of a systemic problem, and we have to address it from that standpoint rather than specifically from the heart or the lungs. And I think that's why some patients get frustrated, because they'll have these symptoms of, I'm really short of breath, I feel breathless, I can't exert myself like I used to, but I'm told that my lungs are fine. And I went to the pulmonologist and they said my lungs are fine. And that's frustrating to patients, because they say, how can that be? And how can I be experiencing these symptoms? But everything on the tests looks like it's normal. And I think that's because it's more oftentimes when those tests have come back normal, it's more that there's not lung damage. It's that it's more of a systemic problem. And we certainly see breathlessness is one of the most common things that I see as well. And I think most of the time after COVID, people tend to hyperventilate to some extent. They take shallow breaths and more frequent breaths, and that's probably related to the nervous system, dysregulation. So we do a lot of work on breathing exercises to try to slow the heart rate, slow the breathing rate down, and in turn slow the heart rate down. And that can really help people with some of those breathlessness symptoms. So I'll stop there. I'm sure there may be follow-up questions related to that.
That's really, really important to know. And you talked about the dysregulation of the autonomic nervous system, and also talked about the inflammation that is impacting a lot of organ systems in the body. Is there any role of autoantibodies, and do you follow them? Do you test them in these patients? Have you seen any correlation with the autoantibodies going up and the symptoms going up?
So there's a lot of research now that's looking at autoantibodies and thinking about is this in part an autoimmune sort of response or condition? I think the evidence is pointing towards that it certainly seems to be, at least in a subset of patients. So I think that as more research comes out, I think we'll probably understand that a little bit more and the relationship between autoantibodies and symptoms of PASC. But I do think that there's a relationship. Clinically, we oftentimes will, as depending on patient's symptoms, will test for rheumatologic conditions, autoimmune conditions, and as part of our workup. But it depends on what symptoms people are experiencing and what and their physical exam findings. So it's not something that we test in everybody. And we are certainly seeing some abnormalities in some patients, but I have to say, from my experience, it does not seem to correlate. And then what to do about that and what the treatment recommendations are is still very unclear. So we don't yet understand really what that means. And so In general, I try in my clinic not to test for things that I don't know how that we don't know how to treat, or if it's not going to change our management or help us to understand what specifically is going on. I'm less likely to check for it. So until there's a direct link between a specific commercially available lab test and a treatment that's available and that's safe for patients to use, I won't routinely check things.
Another thing, Dr. Friedli, that a lot of my friends that I know that who had COVID, as well as patients, they come and talk about brain fog, about not having the same sharp cognition that they had before. And that is something that lingers on. I mean, I have had people share with me they have had brain fog for the past 1 year or 1.5 years. What kind of cognitive changes are you seeing in patients with long COVID, and what is your management approach to that?
Yeah, so another one of the top 3 symptoms that we see are cognitive symptoms, or that brain fog, and that's a pretty broad term, so it can mean different things to different people. But what we're commonly seeing is that people are reporting that they're forgetting words, that they are having trouble getting the right word out, that they're forgetting things that are really commonplace to them. They're getting lost in places that they normally that they frequent, and generally feel sort of foggy, or just not as clear. They're not able to multitask as well as they used to, for example. And again, I think that there's many different causes for this. And so it's important to really look at all of the different factors that can contribute to these types of symptoms that people are experiencing. And I don't think that the cause is the same for every single patient. So there's, again, a lot of things that can impact brain fog, other medications that people are taking that can have side effects, not getting enough sleep, and that sleep cycle disruption that we're seeing very commonly. Again, mood issues that might contribute, as well as the fatigue in general. So we have to look at the cognitive issues in conjunction with all of the other symptoms that people are experiencing. Just like with the heart and the lungs, most of the time, vast majority of time, if you were to get brain MRIs on patients, they would be normal. And so our imaging tests and our lab tests, again, are not very helpful in understanding the cognitive issues. There are some studies that are being done that are looking at some advanced imaging techniques to look at inflammation in the little blood vessels in the brain and the blood-brain barrier, and some microclotting and other things. So I think that there will be more information and maybe some better tests in the future, but currently available clinical tests, it's very hard. Even when we do full neuropsychological batteries on people, so testing people for 4 or 5 hours with very in-depth cognitive tests, we oftentimes don't come up with a lot of deficits to really hone in on what the issues are with people. So again, I think you have to address it with all the other symptoms that people are experiencing. And I certainly have seen a lot of improvement in patients with all of these other approaches that may not be specifically for cognition, but it certainly seems to be helpful. And then I'll say that there's also some ongoing research that's looking at the role of SSRIs and specific antidepressant class medications that may impact, again, that nervous system dysregulation. And some of those are promising in terms of potentially being treatments in conjunction with other things for some of those cognitive symptoms as well.
So, Dr. Friedli, in terms of going back to their previous, physical self, in terms of the things that patients were able to do, in terms of exercise programs, some people are athletes and they would like to go back to running. What would you advise to them? Should they work with a physical therapist? Should they work with an occupational therapist? How should they go back to doing some of the things that they were doing at the peak of their previous before COVID self?
Yeah. So this is another really common concern that patients have, and I have to say, so I myself had COVID early in the pandemic in April of 2020, and I've always exercised a lot. I'm very active. I'm definitely in the Peloton camp community, and this was one of the most frustrating things for me for a good 9 months or more, that I could not return to some of that high intensity aerobic exercise that I really enjoyed. So for me personally, it was extremely frustrating, and I've used my own personal experience with addressing it to try to help other people with some of these related symptoms. And what I found for myself and other patients is that you can't push through it. Our tendency is to try to just overcome it and get back to the same level of activity. And when you do that, you end up having worse fatigue and worse muscle pain and soreness the next day. So you really have to take a very regimented approach to exercise, and do a very little bit every single day, and sort of gradually get your body used to doing more exercise. And you really need to initially focus on low intensity stretching, yoga, light weights or light strengthening exercises, and low intensity aerobic exercise. Because if you try to get into that high intensity exercise is stress. It raises your cortisol levels, it causes inflammation, it sort of contributes to some of the underlying issues that cause some of the symptoms. So trying to avoid that really while you're recovering, and do it very, very gradually, introduce it back, I think is the best way to do it. And we do find that, especially patients who have been dealing with this for a really long time, they become deconditioned. They stop doing the activities, they stop exercising, they lose muscle mass, and that also then contributes to all of the other symptoms that they have. So we need to try to get out of that cycle of deconditioning, and I think you have to do that very regimented. So oftentimes physical therapy can be really helpful to help guide you and make sure that you're doing it in a way that is safe. And also for some patients, monitoring their heart rate and their blood pressure with a skilled therapist can be really helpful to help them, reassure them and make sure that they're doing it in a safe way. So if it's available, I think physical therapy can be really helpful. But people can do this on their own as well. There's a great booklet that we use that was produced by Johns Hopkins that you can Google, called Bouncing Back from COVID, that I think has great information about exercise and breathing exercises, and has detailed instructions and pictures that we oftentimes give to people. So I would definitely recommend that.
I think that's a great information for people, and I think that we can put that information about the booklet in the chat, and people can access it, and I'm sure that it will have a lot of resources for people. Dr. Ridley, are there, apart from your clinic, what other resources do people have? Where can they go? And can they work with their primary care physicians to address some of the milder symptoms of long COVID?
Yeah, I think the reality is that if you think about how many people have been infected with COVID and what percentage have symptoms of long COVID, it will be impossible to treat everyone in one of these multidisciplinary clinics. So I think it's really important to work with primary care and treat these symptoms. I think so definitely working with primary care and really being judicious about all of the testing and the number of places that you seek out care. I think really working with one central person like a primary care physician to help guide you on what you need and what you don't need, I think would be really helpful. We are part of a national collaborative that's run through the American Academy of Physical Medicine and Rehabilitation, AAPM&R. And this is a multidisciplinary collaborative of clinics across the country and experts, as well as patient-led research groups. That their website has a lot of information for people about long COVID. We have started publishing consensus guidance statements on the different common symptoms that people are experiencing. So we've now published one on cognitive symptoms, one on fatigue, and one on breathing difficulties or breathing symptoms. There's more to come, and those are being published through the journal that I'm the editor for, PM&R. So you can also look at those, and those can be really helpful for primary care physicians and physicians in general.
Dr. Friedli, are those available on your clinic website as well?
I don't think we have a link to the from our clinic website, which we should. That's a great idea. We'll do that. But you can get links through the AAPM&R website.
Coming on to, a lot of our patients, they are interested in other holistic wellness techniques, naturopathy and homeopathy. Are there any homeopathy or naturopathic techniques that you are using to help people, or is there any benefit that can people find benefit from any of those remedies?
Yeah, again, I think the research is not there yet for a lot of those things. So so we draw from what people's anecdotal reports are, and from some of the literature on other related conditions or things that we've seen in the past that may be similar. So there is some reported benefit from acupuncture for sure. There's a patient-led research collaborative. So it's a collaborative of researchers who developed long COVID themselves. And so they came together and started doing some really great research related to long COVID. There's a publication by Hannah Davis, is the first author from last year, that looked at an international cohort of over 3,000 patients with long COVID symptoms. And they asked them, what is most helpful for your symptoms? What of all the treatments that you've tried, what are the things that are most helpful? And two of the things that they said were most impactful for them was pacing for fatigue, like we talked about, and then acupuncture as well. So certainly that patients report benefit to that. It's not available to everyone, and there's certainly a cost associated with that. So I tend not to recommend it necessarily, really for that reason, because there isn't specific evidence, and if there's an added cost to patients, and I don't know for sure if there's a benefit, I hate to recommend strongly things like that. But that's certainly something that people have found to be helpful. And then there's a variety of supplements that people try for, especially that have anti-inflammatory properties. So some of those are herbs and spices, and some are supplements. And so some patients find benefit from those, but I think they're not things that work for everybody. So again, I tend not to necessarily recommend those strongly for people until there's more evidence about them, because I again, largely because of cost, I don't want people to be spending a lot of money on things that may not be helpful for them.
Dr. Friedli, one population is our older population, older folks who have had long COVID symptoms. They may have other comorbidities, they may have other long clinical conditions, and in a lot of cases, they may have cognitive decline already. Is there a targeted approach towards helping older folks with long COVID?
Yeah, that's a great question. I don't think there aren't any sort of unique approaches. I think all of the approaches that we use are able to be used in older adults, but I think it definitely is much more complex in that we know that pre-existing conditions impact the experience of PASC and that or long COVID. And COVID oftentimes sort of puts people over the edge or makes some of those underlying conditions worse. And so you have to pay attention to making sure that you're treating all of those underlying conditions and really managing those well to help support people's recovery. And then you have to be a little bit more careful or cautious with some of the medications that are used because they might have more side effects in older adults. So I think with what I'm seeing with older adults, in addition to the medical issues, is that they're experiencing a lot more deconditioning because they're isolated more. A lot of older adults have really been at home a lot, and so their activities are much more curtailed. And when you throw in long COVID on top of that, they end up losing muscle mass and becoming more frail. And so really trying to help them engage in safe exercise and activities, I think is really critical. And again, I think it takes a comprehensive approach in partnership with primary care and a team to really address all of those issues safely in older adults.
I think one of the big takeaway points from this is that patients can be self-advocates, and talking to your primary care physician about physical therapy referrals or occupational therapy referrals is really important so that they can avail of the services and perhaps try and shorten, the period of limitation that they have with long COVID. Coming to the other end of the spectrum, Dr. Friedli, are you seeing kids or youth with long COVID, and do they have access to your clinic?
So, we currently, for the most part, are seeing adults. We do in our clinic see teenagers or 12 and up, and we have some physicians on our team that specialize in that population. But if for the younger kids, they really should be seen at Children's Hospital. We're working with them on helping to develop, or helping them develop a long COVID program there as well. Initially, early in the pandemic, they just didn't see a lot of long COVID in the younger kids, but now that the number of infections are increasing, they're certainly seeing a much higher number of pediatric cases as well.
Thank you. Dr. Friedli, one area where long COVID patients with long COVID really see an impact is with those who have existing mental health problems, depression and anxiety. There is a huge surge in their symptoms. People with who have history of bipolar disorder as well. We have had to frequently adjust medication. Can you talk a little about that? What have you seen in your experience? Have their symptoms worsened? And what kind of modalities have you used with them?
Yeah, absolutely. I think we certainly have seen a lot of people that have underlying mental health conditions, and oftentimes that are really well managed or not really impacting people significantly before COVID, and then they get COVID and their symptoms really become exacerbated. And then we're also seeing people experiencing new issues with anxiety and depressive symptoms after long COVID that they didn't have before. So it is one of the more common things that we're seeing is impact on mental health for a variety of reasons. And it certainly is something that we address in our clinic. So I think we use a combination of approaches, again, like we do with everything. but we often do adjust medications to help. And sometimes that's just short-term adjustments until they're able to recover. And so it doesn't necessarily mean that they're going to be on these medications or at those doses for long-term, but it certainly can be helpful. And then we have started in our clinic we work closely with our rehab psychologists, so they provide individual services for people that are really helpful, but they also have group sessions. So we started doing group sessions at least 6 or 8 months ago. We offer a series of 6 weekly telemedicine sessions for patients in a group of around 8 to 10 people that's led by one of our rehab psychologists. And each week they cover a different topic. And so it's a relatively formal sort of topic-based 6 session series, but it also provides some support for people and sort of that peer support. And they cover topics like sleep disturbance, anxiety, breathing exercises, relaxation, communicating with providers, and dealing with uncertainty and other things like that. So that has been really helpful for patients. I think we've gotten a lot of great feedback from patients about those group sessions. That's been really helpful.
So how long do typically patients stay in your clinic, or are they followed? Like, I mean, is there an indefinite time period, or is there a time until which they are followed, and then do they go out into the community? How does that work, Dr. Friedley? And also, could you please talk about, your center is so specialized. Are you also training other primary care physicians so that they can follow these patients once they are discharged from your clinic?
So 2 great questions. I'll say answer the first one is that we will see people until they no longer need us. So we are with you until you feel like you don't need us anymore. And I think one of the things that we have really found is that these patients with these symptoms need to be followed closely and provided support along the way. And a lot of the strategies are trial and error. And so you do have to modify your treatments and figure out what works for a patient. And then if that doesn't work, try something else. So it really does require ongoing follow-up. And that I think is critical of any sort of treatment of long COVID. It's when you see them once and don't see them back, they still have the symptoms and are struggling. So they will start to see other specialists as well. So I think it's really important to have that continuity. So we try to do, and that's different for every person. So sometimes we see people once, sometimes we see them twice, sometimes we see them, repeatedly for a year or more. So it really just depends on the patient. And then in terms of outreach to primary care physicians, that's something I'm hoping that you're going to help us with. So I'll say we would love to be able to do that. I think that's one of our goals for this upcoming year, is to really do more outreach to primary care and help primary care. It's challenging for primary care physicians, as you know. With limited time, these patients can be very complicated. Their problems are complicated and they have lots of different symptoms. So it does require, multiple appointments and longer appointments sometimes. And that can be, challenging for primary care physicians who are busy. So I would love to be able to give more support to primary care physicians and more resources and be able to extend the reach of our clinic. Because we also know that we're not seeing everybody. There are patients that aren't able to access us either because they aren't able to access telemedicine or come to Harborview or one of our sites, or they don't know about us, or for a variety of different reasons. So we would love to improve the access in the community.
The last question I have, Dr. Friedley, is: are there any limitations on patients who have had long COVID, say on travel or interacting with family, or perhaps gatherings, large gatherings? Are there any limitations that you can see or you can talk about?
So there's no specific limitations in terms of risk of, transmitting COVID, for example. So people with long COVID, we don't see that they have ongoing infection. So from that standpoint, there isn't risk. Certainly people are more fatigued, and that multitasking can be really difficult. And so it does require some planning and some and really thinking about how to structure some of those activities so that it doesn't flare up your fatigue symptoms, and so it does require a little bit more planning than it may, but there's no medical restrictions per se.
Thank you so much, Dr. Freaky. This has been an amazing session in terms of the invaluable information you've given us, and I'm sure we were able to get to most of the questions today, if not all. But this is a vast topic, like you and I were talking before, and I know that there will be a lot more sessions that we will request from you to be able to really bring about awareness in the community. And thank you so much for all the wonderful work that you are doing for us. And thank you for initiating this long COVID clinic. I really, really am grateful that you joined us today.
Well, thank you for having me, and I'm sorry that we couldn't get to all of the questions, but it is a lot to cover. So I'm happy to come back, and I'm also happy if people want to reach out to me directly with questions. I'm also happy to answer any questions that people have.
Thank you. Thank you, everybody, for joining. There are links in the chat for our website, the long COVID clinic, some of the other things that were mentioned in today's session. We will be holding hopefully another session in a couple of weeks, so look forward to that. And stay well and stay healthy, and we'll see you soon. Thank you.